Hello, we are so excited that you're interested in Lipscomb University College of Pharmacy. My name is Robin Parker and I'm on faculty here at Lipscomb, and this is my colleague Dr. Jessica Wallace, who's also on faculty. We wanted to tell you a little bit about what we do here at the college and what benefit it could be to you if you choose to come to Lipscomb. So our first year student pharmacists are enrolled in a class called Biostatistics and Drug Literature Evaluation. That is an incredibly important course as there is medical information published daily. We even go so far as to have our third year student pharmacists present in something called Practice Seminar. That is where they get up and present some of that latest information that's being published, and it's presented to their peers, other student pharmacists, as well as faculty and outside practitioners in the pharmacy world. So that is something that has worked really well for our students.
What do students say when once they leave pharmacy school and graduate, about the course? Because it seems a little nerve-wracking as a student to give a presentation among your peers, but how does that kind of prepare them for practice?
So that's a great question. So we constantly get feedback from fourth-year students that are out on rotation with other programs and other practitioners, as well as students that are in their first and second years of residency that give us the feedback that this being an integrated course has been so beneficial to them because they feel that they are ahead of their peers, ahead of their colleagues at their new jobs with how they need to interpret and present newly published medical information. So Dr. Wallace, how does this all play into what you do at Lipscomb?
Well, in order to practice medicine and to incorporate the evidence into your practice, you have to be able to learn the clinical aspects about the disease states and how to treat the disease states with medications. And so in my course in pharmacotherapy, in your second year of pharmacy school, you get to transition into the kind of clinical application. You take the knowledge of the literature, you take your knowledge of pharmaceutical sciences, and you treat disease states most effectively. And so being able to draw from Dr. Parker's course is critical, and to be able to take that literature and to make sure we are providing the best care for patients. So I practice at the Nashville Veterans Affairs Hospital here in Nashville and get the pleasure to serve veteran patients. Robin, where do you practice?
And I practice over at Vanderbilt, and I work with the elderly patient population there in the hospital. So but throughout all of our practice sites, no matter where you end up in your fourth year and beyond, the ability to interpret medical information is critical for implementing evidence-based medicine, and that is something that we feel our students are way ahead of the curve on.